Riverside Healthcare puts the health and wellness information you need well within reach.
Welcome back to the Well Within Reach podcast. I'm your host, Helen Dandurand, and today I'm going to be joined by Dr. Rosvida San Gabriel, pediatrician at Riverside Medical Group's Pediatric Specialist Bradley office, to discuss all that you need to know about childhood immunizations.
Healthcare can be confusing, but thanks to your My Riverside MyChart, you can easily manage not only your care, but your family's as well. With a single click, your My Riverside MyChart lets you stay well connected to the same information your provider sees. You can view your health history, get test results, request prescription refills, pay your bill, or make an appointment. Manage your care from anywhere, your laptop, phone, or tablet. Learn more and enroll today at riversidemychart.org.
And we're back with Dr. San Gabriel. Thanks for being here today.
Hi.
We're glad to have you. So, could you start by just telling us a little bit about yourself?
All right. Well, I'm one of the new kids in the block, I guess. Not the newest one because we have another one. So I've been here at Riverside since June, and I'm the new pediatrician also at Bradley, joining Dr. Batista. And we've got our new member also, Dr. Herrera. So there's 3 pediatricians in our practice right now. So yeah.
Awesome. And jumping into the basics of this topic, can you tell us from the start, what is an immunization?
Well, immunization really, in general terms, only means that it's actually a process where your body, and we're talking about basically for this topic right now, is able to resist and also protect you when you're faced and exposed to an infection. So that's basically immunization, and which sometimes it can be interchangeable with immunization and vaccination. But basically for this talk, we'll just say immunization and vaccination are basically the same for now.
Okay. So why is it so important to get your immunizations rather than just building up your immune system naturally?
Okay. That I hear that often. I mean, back in the days, when they can actually feel, and we're talking about 1700s, 1800s, where you actually see people, well, they're miserable. And of course, the ones who are affected much are the children. So natural immunity is not even considered like a treatment, because for you to have natural immunity, you have to go through the illness. You have to be sick first. And who knows what side effects you're going to get. So you have to go through the illness first, but your immune system starts developing antibodies to it. So that's your natural immunity. So you have to be miserable first before you get the antibodies. Now, with the vaccine, though, what the vaccine actually does is also simulate that. And that's, I think, where a lot of confusion goes, because I think people think of vaccines as a medicine, something foreign, that it's the vaccine that's actually doing the work. In reality, it's actually our immune system doing the work. It's just the vaccine is trying to simulate, to take part of that organism or that bacteria where it will not give you an infection. So when you have, say, for example, you have chicken pox. So you got the chicken pox, but it has entered now your body, and it's like in big dose. Think of it like you got the blast of chicken pox. So you have a higher response to that one there, and that's why you are miserable, you have symptoms, you're itchy, you have a high fever. Although they said that natural immunity is actually better, the problem about that is that you're going to be sick and you're going to be ill. So who wants to take that risk? I'm going to get immunity, but I have to be sick first. So the vaccination actually came up because they want to do that. And what they did is that we'll just get a sample of this bacteria. And all these scientists actually, and this is controlled, this is all scientific, they're going to give little dose first where you don't have to be infected. And that's why a lot of these immunizations, they're just one big blast, like when you're sick. So say, for example, chicken pox, you're going to get one now. And then once they found out, oh, okay, well, it's kind of waning a little bit, so we have to boost them. So that's another topic. But this is very controlled. And it's little doses where you don't get sick, but you also have the same effect of protection like the natural immunity. So that's basically what we'd prefer to get the vaccine than being sick.
That makes sense. I think the chickenpox is such an interesting example because I was talking to some of my friends and we were all like, None of us have ever had the chicken pox. That's so weird. I feel like everybody always used to talk about it, and then we looked up
Yes.
when the vaccine came out, and it was right when we were
Mhm.
born. So it's like, well,
I know, I know.
something's working.
I know, actually, I remember this because I just got out of residency, and when it came out that it's recommended for the school, a lot of parents are not really happy because they really think like chickenpox is no big deal. So that's why they have this like I'm thinking like the what? You have chickenpox parties? And I'm thinking like where I grew up, there's no such thing because
Right.
you get sick, you're sick. But the thing about this is with the chickenpox parties, they only see like, okay, well, you get sick, you're going to be miserable, you're good, you're fine. Now you've got immunity. But they don't realize the ones who did not get chicken pox when they're an adult, that's the one that they have it really bad. So they really are not aware of the full scope of what chicken pox does. Because when all these scientists pick, okay, what vaccine are we going to develop right now? They're just not going to get something out of the hat. They have to get something that's very significant to the population that will protect them. So and that's why they picked up chickenpox because people are not aware, but people can die from this.
Yeah,
Mhm.
definitely, definitely. So, is there a set timeline, like schedule to get these immunizations? I know there's like a lot of different
Mhm,
ones.
mhm. It depends on what it is. And since I mentioned about like you give like many doses of that one depending on how you respond. So say for example, chickenpox is two. You get one when you're 1 year old, and then now you have another booster at four. The DTAP, polio, hepatitis B, because of how that organism is to protect how you're going to produce their antibodies. They've studied that you have to give a timing of like 2 doses or 3 doses to meet that complete immunity. So that's why it's not the same for every vaccine. It really depends how you respond to that one. So yeah, so it depends.
Got it. Yeah. And that was kind of going to be my next question about,
Mm,
if there's a rhyme or reason for the schedule that there
mhm.
is and why different boosters you need and not others. But I think you
Yeah.
kind of answered that in saying that, different just vaccines work differently. And so
Hmm.
making sure that people are up to date on the timeline in which it is most effective, I
Hmm.
would say,
That's
right?
right. Yeah.
Cool. We're going to take a quick break to talk about finding a primary care provider. Riverside knows that health is your greatest asset and that your primary care provider is your partner in health. Find a primary care provider that fits your needs at riversidehealthcare.org/primary care. So, I have heard people talk about vaccinations and saying by getting vaccinated, you're protecting those kids and the people unable to get vaccinated. Do you hear that in your practice as well?
That's the thing because a lot of patients are not aware that they have a direct effect for the people that they're around them, for especially for the ones who cannot get those vaccines. If they're able to get the vaccines themselves, they're actually protecting other people too.
Right.
And that's what we call the herd immunity. We kind of want to call it now the community immunity because people don't want to be identified as cattle, I guess. So yeah, with the herd immunity, if you're just going to think it this way, if you're in a room and there's 10 of you, and there's one person there for some reason cannot get the vaccine, either he's immunodeficient or he's just not scheduled to get the vaccine. By him being surrounded by these people who are immunized from that one, that illness, that medical condition is not able to penetrate that room because it's not able to spread in that room because everybody already has antibodies to it. So it's kind of like a fringe benefit. You're actually helping the other ones who cannot get it. And that's why it's called a herd immunity.
That makes sense. What happens if a child gets behind on their scheduled vaccines? Like maybe they were sick or unable to get it or traveling. Is there a way that you can kind of make them up if it's not on time?
Oh, yeah, that's actually the least of their worries because we have ways how to do that. We don't repeat, unless, of course, there's a mistake on how the intervals are. But basically, yeah, the parents should not be worried about how we're going to schedule to make sure that they're updated with the shot. So, but yeah, but it's not the same because it's not the one size fits all because it depends on what their age is, what they need. But we know how to do that. There's ways how to do that. So, yeah,
Got
it
it.
shouldn't
So
be a problem.
you would just reach out to your
Oh, yeah.
provider and
Hmm.
got it. Are there any trusted sources that you tend to send parents to if they're kind of on the fence about vaccinating?
Oh, okay. I like giving handouts. So when I have patients who like handouts, I like to pick specifically for them because I don't want to give them like a journal where it's gonna do a snooze. So usually just pick the one that's really really quick. But me personally, the ones that I like a lot, where I always go back when I need resources. One is the immunize.org. That I look it up all the time. They're the forefront of information. CDC, of course, but unfortunately, it's getting a bad rap right now, being politicized and all. But CDC actually has a wealth of information about anything really. So CDC, immunize.org. Now, also other websites that I check are the ones from hospitals or children's hospitals who are also very well known when it comes to immunizations. And one comes to mind is the Children's Hospital of Philadelphia. And there's Dr. Offit. He's very well known with immunizations. And I also look at their website, and they are also, back then, they would give like free materials for immunizations. And he is, how would I say this? He's like the master when it comes to immunization. And then Texas Children's also too. I remember that they would give out like some books about real life people who actually had the disease itself. So those are the ones that I usually look into because, well, they've been always reliable and they're easy to understand and easy to read if I'm going to recommend it to my patients.
Yeah, that's great. That sounds like you have a lot of different resources for people to check out. So that's awesome. Is there anything else that you want people to know about these immunizations? If they're on the fence or something like that, can they call to talk to somebody about it at your
Oh
office?
yeah, oh yeah. I mean, the most important thing is just to open up, and because when they come to the office and if I notice that there's certain immunizations that are missing, I usually want to ask what their thoughts are, what they think about this vaccine, why did they held off, and then that way we can have a conversation. Then hopefully I can help them if they're willing, if I can give them whatever information they need. But just start the conversation basically.
That's awesome. Well, we're so thankful that you were here today
Yeah.
with us. And thank you so much, listeners, for tuning into the Well Within Reach podcast brought to you by Riverside Healthcare. For more information, visit riversidehealthcare.org.